King Saud University Medical City. Medical cities and hospitals are considered to be one of the most public places, which require full commitment by highest safety standards, where they have different activities that work all the time and increases risk possibility in comparison with other places as well. In patient availability that requires to evacuate them by following some special procedures in case of any risk appearance. Therefore, we will present to you some instructions that should be followed for your safety and patient safety. Electrical safety instructions. All external electrical extension cords are not allowed, while KSUMC provides electrical sockets at all areas as per recommended standards and specifications. All electrical heating devices are not allowed, such as microwave, kettles, and sensors inside patients' room and staff offices. Some heating devices are limited according to special places like in patient wards, kitchens, and lounge rooms, but we keep it on off status if nobody is there. Be sure that all electrical equipment, devices, and lights are turned off before leaving your working areas. Storage. It is not allowed to store materials randomly or directly on floor, while it's instructed to keep stored materials at a place that is not less than 10 centimeters high of ground surface, and to keep it not less than 30 centimeter space between stored materials and ceiling in case storing at upper shelves. Also, storing is not allowed in corridors, stairs, or emergency exits. Hazardous materials pictogram. All staffs have to know hazardous material pictograms as follows. Health hazardous material. Flame, flammable material. Exclamation mark, material causes skin, eye, or respiratory tract irritation. Gas cylinder, material contains compressed gases. Corrosion, material causes body tissues harmful. Exploding bomb, material can explode. Flame over circle, oxidizing material. Environment, hazard materials to aquatic environment. Skull and crossbones, acute toxicity material. Material Safety Data Sheet, MSDS. MSDS or SDS includes special instructions for dealing with each hazardous material. For example, how to transfer, use, store, dispose, and dealing with hazardous material, spill or exposure. All staff should know locations of Material Safety Data Sheet, MSDS, that are used in their department and keep it accessible for all to use in case of emergency incident. Also, hazardous labels and pictograms should be available on all hazardous material containers and stores according to MSDS recommendations, as it is important to periodically notify the hazmat officer for all hazardous material inventory that are located in your department or working area. Hazmat officer responsible for hazardous materials in KSUMC. Please contact KSUMC Hazmat Officer in case of need for additional help for usage or transferring of any hazardous material. Smoking. Beside of harm caused by smoking, it is considered as one of the most fire causes in public areas. Therefore, smoking is prohibited inside KSUMC facilities, and safety officer can penalize you for smoking inside KSUMC premises. Fire extinguishers. All KSUMC staff should know the type of fire extinguishers, how to use, and where to find in their work area in order to use in case of need. Fire extinguishers types. Water fire extinguishers, used for fire of solid materials only, like paper, wood, and clothes. Foam fire extinguishers, used for fire of fluid and flammable gases. With chemical fire extinguishers, used for fire of cooking oil and fats. Carbon dioxide, CO2 fire extinguishers, used for fire of electrical equipment and flammable metals. Dry powder fire extinguishers, used for fire of solid materials, flammable liquid materials, and electrical fire. How to use fire extinguisher. Use of fire extinguisher is implemented by following the methodology of PASS. Each letter means a mission. P. Pull the pin. A. Aim nozzle toward to the base of fire. C. Squeeze the operating handle. S. Sweep from left to right. Evacuation code red. How to act during fire. In case of fire, we have to follow the methodology of RACE. Each letter means a mission. R. Rescue patient or follow colleagues means to transfer patients or colleagues from danger area to safe area. A. Alarm means to activate fire alarm system and call the emergency center. C. Contain the fire means to close all windows and doors in order to contain the fire in one area as possible. E. Extinguish or escape means to extinguish the fire by using fire extinguisher or evacuate the fire area immediately. Evacuation. Evacuation is done on 2 steps. Horizontal evacuation takes place in case of fire spread partially in one area or zone of the facility. Then, movement of patients and staff becomes horizontally from the affected area to safe area in the same floor of the facility. Vertical evacuation. It is as per directing of emergency command room of all patients and staffs in case of fire spread in more than one area or in all hospital. Then evacuation is done in vertical way until reaching to the assembly point. We would like to inform you that KSUMC Environmental and Safety Subcommittees implement periodic round for all clinical and non-clinical area to ensure their safety conditions implementation and that they are ready for any help that you may need. Thank you very much. Safety is commitment and responsibility of all. With regards of KSUMC Environmental and Safety Committee.